Hi, my name's Stephen Duckett. I am an economist. I used to be President and Chief Executive Officer of Alberta Health Services, and now I'm a Professor at the School of Public Health at the University of Alberta. I've been asked to talk a bit about the sustainability of the Canadian health system as we move forward and as we look to the impact of an ageing population. There are two messages I really want to get across here. First is the overwhelming evidence from the literature is that ageing won't have much of an impact on the sustainability of Canada's Medicare system. There are a couple of reasons for this. First, the big impact in the past and foreseeably into the future is about technological change and changing practice patterns. Ageing contributes a very, very small impact, if any. The research evidence can be summarised this way. If there is an impact, it's small, and there is a debate about whether there's any impact at all. What we basically know from the research is that the costs of healthcare are more determined by how long you have before you die rather than how long it has been since you were born. And so once you take time to death into account, the evidence about any impact of ageing more or less disappears. But that doesn't mean to say that we shouldn't do anything. Obviously, if there is an ageing impact, it's going to be small and gradual over time. That means we have some opportunities to actually address some of the changes that we need to address in the Canadian healthcare system. As people get older, there's more chronic illness. There's going to be more older people around. So it's going to be critically important that the Canadian healthcare system gets better at dealing with people who have chronic illnesses. That means we're going to have to put more emphasis on primary healthcare. That means we're going to have to put more emphasis on integrated healthcare systems. None of this means we have to do anything about changing the universality of the healthcare system. None of this means we have to think about private sources of funding, but it does mean we have to think more carefully about whether the healthcare system we've got today is positioned right for the future. So they're my two messages. First, that the ageing impact may not exist at all, but if it does exist, it's very small. But nevertheless, we need to change the healthcare system and we need to actually make it better for dealing with people with chronic illnesses. Thanks very much.